it be true? No more doctor-patient confidentiality? Is the federal government gain access to all our medical records? Now, according to Congressman Tim Huelskamp, the answer is yes, and he joins us. Good evening, sir.
Good evening.
So tell me, according to what I understand is that under the new national health care, it's your belief that the federal government will have access to all our medical records?
Well, Secretary Kathleen Sebelius has proposed a rule back in July 15th that would mandate either a national collection of all our medical records or state-level collections, which would allow the federal government, even bureaucrats in Washington, D.C., to have direct access to our private confidential medical records. And that's in the rule, and that's very concerning to many of us.
So if you're having a biopsy, let's say, and you have it in your home state, and that gets fed to the federal government, are they getting the actual, you're getting your name, the test results? Are you getting everything from the biopsy, or is it just the fact that you had the test?
The raw claims data, which is undefined in the rule, and there's been a number of comments submitted, but the idea here is under Obamacare is to find out what that information is, to find out whether you're healthy or whether you're at risk, and under Obamacare they subsidize the insurance companies that insure sick people and vice versa on the healthy people, and this is the information that Kathleen Sebelius and the President need in order to implement that provision in Obamacare.
Well, you know what the sort of awkward thing, I think, is that whether you're for the national health care or not, is that members of Congress and the Senate voted on, the President signed it, but now we've got these people in the HHS and government employees who are making these rules now, who are deciding how it's going to be implemented. And if this apparently, as you say, is one rule that wasn't even voted on by members of Congress.
Well, the infamous words that we had to read the bill to see what's in it. Now we have to actually read the rules to see what's supposed to be in the bill. But so it mandates this massive database of personal confidential medical records, and I think folks that even supported the bill are going to look at that and say, hey, that's not what we had in mind. This is, you know, the idea. The HHS has responded, says, oh, don't worry, your data is safe with us.
How? How do they figure it's safe? I mean, if you still got some, I mean, especially people who, I mean, I imagine even members of in politics, we're going to know who had a biopsy, who had an AIDS test, who had a pregnancy test, who has a heart problem.
Yeah. 1 week ago, 4.9 million military patient records were lost or compromised or breached. Less than a week ago, 4.9 million. That's out of TRICARE. Numerous other agencies, we're talking about millions and millions and millions of patient records have been breached. And the idea that the government's going to do a great job of protecting our medical records, that scares me, and I think that should scare most Americans.
It's almost, I would suspect that those who didn't like lots of parts of the Patriot Act, whether, you know, when the government was spying on the library reading, aren't going to be particularly happy to find out if the government gets your medical records. I wouldn't imagine those people would be particularly happy.
No, absolutely not. And we're trying to get the word out. Folks understand that. And this was actually brought to our attention by Kansan, came into the office and said, hey, did you see what was in this section of the rules?
Is anything going to happen?
Well, we're working to try to defund this database, and you know, the House voted to repeal Obamacare, the Senate did not, but the money is going to be in there to put together this massive database. If we can take away the money this year, we can stop the database.
Does Secretary Sebelius think this is a good idea, that all this information go to the government?
Certainly. There are a number of proposals that either it's a centralized database where all the data is in Washington, D.C., or it's in every state capital. But that is the proposal from the administration, to collect all this data in 1 point or 50 points and make certain that they have access so they can determine whether or not we're risky or whether we're healthy or unhealthy. And that's a really serious threat to patient privacy and our doctor-patient confidentiality.
Congressman, thank you. We'll look deeper into this. Thank you, sir.
Okay, thank you.
Coming up.